Mm-hmm.
Hi, I'm Dr. Max here at Max Medical Robotic Hair Restoration Clinic, and today we decided it might be a good idea to show what's going behind the scene during the procedure. We're going to have very minimally processed video and to show you different stages of the procedure and how I decide what best approach, what's the best strategy with each individual case of the patient, because we're all different. Some people have certain texture of the hair, and we need to use a specialized approach to get the best results. And today we have an African American patient with stage 3, Norwood 3 hair loss to the front of the head. And we decided to start with manual extraction of follicular unit extraction. So we're going to patient arrived at 7 a.m. I've completed the hairline design. I think will match perfectly to our particular patient. And the manual extraction is performed with Trevelini device. Using a specialized technique of partial dissection and then a blunt introduction of the punch into the tissue. This way we can preserve as many follicles as possible, and we can achieve close to 95% yield with this type of extraction. Also, it is important to mention that follicular unit extraction in African American patient has tremendous advantage over a strip procedure. It doesn't leave any linear scar. Many patients would love to have their hair cut very short, and that's definitely is possible with FUE. Additionally, the recovery time you can probably cut in not in half, probably 3 times. It's much faster, and most of the time our patients are able to return to normal activity just after 2 or 3 days, as well as the hair growth is, in my opinion, is more robust after a FUE procedure, since we don't really cut anything artificial from the strip, but we remove the entire follicular unit as it's intended to be. So the next part would be implantation using direct graft insertion, and this is something that we, in our opinion, perfected here in Max Medical. We'll be using special pens or direct implanter devices. Will be loaded with the graft and inserted one by one into the recipient area. And we'll show you how things progress and the final result right after the procedure.